Hello, everyone. I'm Hadassah Israel, the Community Relations Manager here at ELC. We want to thank everyone for joining us on Zoom, and for those that are on Facebook Live. Can the panelists and everyone here give a quick wave to our Facebook friends this afternoon? Thank you. Thank you. We are so excited to be here to raise the roof, and you can hear about all of the great resources that we have available in our counties and our community agencies. Have joined us today to share those resources with families and providers like you. So just a couple of housekeeping items I want to go over. For all of our attendees, please be sure to, if you have any questions, slide your questions in our Q&A chat feature. If you're on Facebook Live, we have someone that's monitoring that chat, and they'll share they'll read your questions out loud. So feel free to share that information in your chat. And I want to introduce Tevis Paige. She is our CCR&R coordinator. She coordinated this lovely event today. So we are so excited for the work that she helped to put into this. And now I want to turn it over to our CEO, Lizbeth Murphy, who's going to do the welcome. Liz.
Thank you, Hadassah. Hi, everyone. How exciting. So good afternoon, and everybody. And thank you for joining the ELC for our second virtual community resource fair. I am so happy that we're able to engage with our ELC families, our childcare providers, and the community to introduce some of our community resource partners throughout the Big Bend region. The community resource partners throughout the Big Bend that you'll meet today are just some of the many resources in the area. If you need information for other community resources, please call or email our CCR&R team at 1-866-973-9030 or ccrnr@elcbigbend.org. Don't worry, it will be placed in our chat so that you can retrieve that information at a later time throughout today's program. I hope you enjoyed today's event, and I look forward to raising the roof with resources. Back to you, Hadassah.
Thank you, Liz. All right, next slide. There we go. So I want to share a little bit of information all about ELC. First up, ELC, we cover 7 counties. Those 7 counties are Leon, Gaston, Wakulla, Taylor, Madison, Liberty, and Jefferson County. And we offer 3 core services. So if you take a look at our slide, if you're on Zoom, if you're on Facebook, I'm going to share those 3 core services with you. Child Care Resource and Referral, which is our resource program that actually put this resource fair together. And all of the community agencies here are our referral agencies. We also offer VPK, school readiness, and the warm line and assessments. All of these services can be found on the website that Liz just shared, but I'm going to share it one more time, elcbigbend.org. We want you to take a look at our website. We actually have a new website. It's very user-friendly, so feel free to take a look and see some of those great services that we provide there. All right, for school readiness, we are actually accepting families right now for our school readiness program. We don't have a long wait list where you'll be on there for weeks and months. So please go to the website, fill out the intake form. We'll also drop the intake form in the chat. And that intake form will go directly over to our CCR&R, Child Care Resource and Referral. And Child Care Resource and Referral and Family Services will work together to help provide you the services that you need. And then here's a little bit of information on the screen. Parents and guardians must be working at least 20 hours to participate in this, and you will have to show verification and information. Gross income must be at or below 150% of the poverty line, and families must pay a copay for childcare based on their family size. Next slide. And again, we want to thank all of our panelists that are here joining us today. We're getting ready to hear from them really soon. They're going to be sharing the resources that are available with their agency to assist you all as well. And without further ado, I'll call up our very first agency. It is Neighborhood Medical.
Hello.
Yes, you're on, Joseph.
Hello, everyone. Thank you for having me. My name is Joseph Ward. I am the outreach specialist and health educator for Neighborhood Medical Center. And Neighborhood Medical Center, we are a federally qualified health center, which means we provide health services for people who have insurance, for people who are underinsured, or people who may not have health insurance at all. But the health services that we provide are at a low cost. A bit of background about Neighborhood. Neighborhood started in 1974 in the basement of a Presbyterian church. And it was created to provide medical services to people from low-income communities at a low cost. Some of the services that we provide are primary care, women's health, OBGYN, pediatrics, immunizations, chronic disease management, health, mental health, smoking cessation, case management. We have on-site pharmacy at 2 of our locations, at our 438 West Brevard Street location and at our 872 West Orange Avenue Street location. We're in conjunction with a 340B reduced cost pharmacy program, and I'll explain that in a minute. Our specialty cares are dental and eye care, and any other services or care that we need to provide to our patients, we can refer out. Now, I'm a part of our Ryan White HIV/AIDS prevention program, and I'm the health educator for our program. So we provide comprehensive HIV care for our clients who are HIV positive. We have our clinical setting where we bring our patients in and we can treat them with our provider, Ms. Elena Steeple, and I'm over the outreach program. So I'm in charge of going out into the community, doing presentations, doing HIV testing, whatever they need us to do in the community, we're out there doing. But COVID happened, so with our outreach, we're providing COVID testing, COVID vaccinations. We have a mobile unit, and with our mobile unit, we're able to basically be anywhere and everywhere we need to be. And within this mobile unit, we not only provide HIV services, but we provide our primary health services through this mobile unit as well. We have several different locations, as I said, our 438 West Brevard Street location, our 872 West Orange Avenue location. We have a location in Havana, Florida on West 5th Avenue. We have our location at Rickards High School, and we also have a location in the Smith Williams Service Center on Pasco Street. So with all these locations and all the care that we have, like I said earlier, we're able to provide comprehensive services to our patients who may not be able to afford healthcare, but through Neighborhood Medical Center, they can get all the care they need. And like I said, we can refer them out to the services that we don't provide. So that is Neighborhood Medical Center in a nutshell. And I appreciate you all for having me.
Great. Thank you so much, Joseph, for sharing the resources available at Neighborhood Medical. We have up next, Simply Healthcare. Simply Healthcare. Brent Couch. There you go. Take it away, Brent.
Well, hey, everyone. It's good to see everyone today and be on this event. So I am Brent Couch. I'm with Simply Healthcare. I have a presentation, so I'm going to go ahead and share that. Let's pull that up. Hopefully everyone can see this. Can you see this? Let's see here. Is everyone able to see? Okay.
We
So
can-
I'm with Simply Healthcare. One of the things that we do is we provide a program called Florida Healthy Kids. And Florida Healthy Kids is statewide. It's for children between the ages of 5 to 18 years of age. Do a quick overview. If you have any questions, my contact information is in the chat and later on in this presentation. As mentioned, it's for children 5 to 18. They can be a citizen or a qualified non-citizen. They must not be eligible for Medicaid to be eligible for Florida Healthy Kids. And then there are some income requirements to see if they're eligible. How to enroll. So it's pretty simple. You can actually go online to floridahealthykids.org and they have an apply section, or you can call Florida Healthy Kids directly at the phone number listed on the presentation. And then when you call, that's when you can make the selection for Simply Healthcare to be your plan for Florida Healthy Kids. We do have a large network of providers, about over 10,000 of doctors, pharmacies, and hospitals. So we have a large network. As far as the amount that someone would pay, we have a subsidized option. There is a subsidized option through Florida Healthy Kids, which a family premium could be $15 or $20 per month. That is depending on income for all eligible children in the household. So it can be 15 or 20. So that is a good option to save money, because I know, these days everyone's trying to save a little bit. Now, what do you get when you get Simply? You get a lot. We'll take care of your basics, doctor visits, medical equipment, imaging like x-rays, ultrasounds, MRIs, lab work, prescription drug benefit, hospital care, specialty services as well. So there's just a lot included in here. Also, if a child, can get dental, and dental is provided through a different company, but they would, when they're applying for Florida Healthy Kids, they'll let them know if they qualify for dental, and they'll connect them to one of the dental plans. Just wanted to mention, but we provide the medical and the vision. So far as vision, we do cover testing for eyesight. We do cover a pair of glasses. So if that's needed, we can take care of that. Also, contact lenses as well if needed. And copays are reduced. Copays with us are $5 for a specialist. So it's really pretty affordable in my eyes. So that is something that's available. Prescription drug benefit, the copays are reduced with that as well. So there's $5 copay for prescriptions. So we know, everyone's living on a budget, so it's pretty affordable. And that would be for a month's supply, up to a month's supply. We have a bunch of extra benefits too. Every month, members can get $10 that they can use to buy over-the-counter items, from hygienic items to medicine. We also have transportation. If that's necessary, we'll provide round-trip transportation to and from appointments. We just do a lot. Nutritional counseling, because we know to feel good, you need to eat well and take care of your body. So there's just a lot of stuff that we try to provide so our members can be as healthy as possible. Also, now being the school season, school break, we do provide coverage for things like camps for kids, after school activities or camps, which would be $50. I always like to let people know about that. And then when you're getting ready to go back to school, we provide $50 for school supplies each year. During the summer, we provide a summer book subscription. You can get 12 free books. We provide tutoring, 24 hours of one-on-one tutoring in math, language arts, and English, and just a lot of other stuff. $100 for textbooks if members getting ready to go off to trade school or college. So there's a lot of extra benefits that are included. A bunch of extra therapies as well, art, equine, pet, just a bunch for ones too. In addition to your traditions like physical, occupational, and speech. Just some extra benefits here for individuals with asthma. We take care of that as well. And then we have healthy reward programs. If someone happens to be pregnant, we do have a program called Taking Care of Baby and Me, which provides incentives in the form of a gift card that would be mailed out to the member just for going to prenatal, postpartum checks, and then a baby postpartum checks. And so that is available. So certain things may require referral, some will not. These are some services that do not require referral. However, some may. So just kind of want to end it off here. I know I have more slides to go through. We do have a care coordinator that will work with our members. So if a member has complicated medical issues, we'll come along, we'll help connect them to resources. They'll be assigned this care coordinator. They'll have the phone number for the care coordinator and email address so they can stay in contact. This is just some helpful information if you need to reach anyone. We do have a 24-hour nurse line, so you can call at any time to get a nurse on the phone, because that's sometimes you just need to talk to someone about what next steps to take. And this is my contact information. So if you have any questions for me at all, feel free to get in contact with me. I'll be glad to talk with you at some time. And that's all I have, and I really appreciate everyone today. Thank you.
Thank you, Brent. Great resources over there at Simply Healthcare. So be sure to reach out if you have any questions. And again, those for you that are attending via Facebook Live or Zoom, these resources will be emailed out to you no later than next week in a pamphlet, in an electronic packet. Okay, so be on the lookout for that if you provided your email. If you didn't provide your email and you would like that same packet, please use the chat and put your email in there, and we'll be sure to get that information out to you as well. All right, up next, we have Big Ben Ahek. Big Ben Ahek, you're up next. So join us. Feel free to unmute yourself. There you go. Hey, Yolanda.
Hey, good morning, everyone. Thank you for letting me in. I had a little bit of a snafu this morning with my internet, so thank you. Well, first, I'd like to introduce myself. I'm Yolanda Gillette. I'm the outreach manager, but I'm also a bilingual health educator at Big Bend AHEC. AHEC has been around for over 25 years. We cover 14 counties. We are based in Leon County. We are a nonprofit agency. I work with a lot of the folks that are on the panel today as community partners. One of the things that we are most popularly known for is working with Tobacco Free Florida. We are the group quit portion of Tobacco Free Florida's tobacco cessation program. One of the great things that we do is we provide support in the community when there is someone trying to quit nicotine products. As we know, specifically during COVID, stress level goes up, smoking goes up. And today we also have the increased numbers of people in all ages that are also using the electronic nicotine devices. So we are here to support the community. Our service is free. The commitment is you meet one time with one of our counselors. We are doing virtual classes to make it more convenient for people who, specifically mothers, fathers who have difficulty finding childcare. You can do it from the convenience of your home. You could do the virtual class from the convenience of a smartphone. And we always will try to work with the individual looking for help. So if neither one of those is an option, we can try to find a in-person class for you or even do it over the telephone. So what the class entails is it's a one-time 2-hour class, and we're going to cover everything that has to do with tobacco use, the reason you're addicted. We're going to pinpoint the reasons that you are using tobacco and guide you and encourage you to find a way to quit the nicotine habit. And it is a very supportive team. I myself am a former smoker and I'm a trained tobacco specialist, so we cover it all. The one thing I would like to let you know is that in addition to giving you support, we will absolutely provide you with nicotine patches and nicotine gum or lozenges to help with the cravings. I often get asked, well, Yolanda, why would I choose that instead of just staying with the cigarette? Fun fact about tobacco, one cigarette has over 600 chemicals. When we are in the process of supporting you to quit the tobacco habit or the nicotine habit, we're providing you with a smaller amount of nicotine, but enough to help with the cravings as you're going through the process mentally and physically to quit tobacco altogether. So it is a program that we work with you. We have a support team. We are not going to quit and let you figure this out on your own. We have many different options through Tobacco Free Florida, group quit being the preferred because that's where statistically the highest numbers of success are. And I will, when I'm done speaking, I will put all of the information for everyone to see as how to contact us if you're interested in joining a class. Again, the classes are free. We have virtual, we have in person, but we will give you Nicorette, Nicoderm to help you through the process. Additional program that we have, which has become very popular through the 14 counties that we cover, is the diabetes program. Our diabetes program is called DEEP, Diabetes Empowerment Education Program. I'm also a facilitator in English and in Spanish, and that is a particular program that is interactive. There's demonstrations, there's role play, there's a lot of engagement. It's a group learning environment, and it is really a supportive environment to help you learn on how to manage the disease. Now, what's great about our particular program versus some other programs that might be out in the community is that we welcome people of all ages, and we welcome you to bring a partner, specifically a partner that you either go grocery shopping with and buy food with, and someone that you share a meal with. Because we find that when you have a supportive team in your own family, the success rate is much higher. So we always welcome you to bring a partner. Our diabetes program is a 6-week program. We meet once a week, same day, same time of the week. It is 2 hours, and we cover from understanding and monitoring diabetes, understanding the human body, risk factors and complications. We cover foot health in great detail. We go over nutrition education, meal planning, understanding and managing your diabetes and the medications, and physical activity, of course. We provide you lots of goodies. We provide you with a plate, exercise bands that you can do some form of exercise while sitting in front of the TV between in commercial breaks. And then another important part is we help you learn to manage stress, which increases sometimes your sugars, but also how to access the most out of your team, out of your medical team. A lot of people sit in front of their doctors and they don't really know what to ask or what to be prepared for. So we also cover that in our diabetes class. And then another one that could be very important to the folks on that are listening, we are also licensed navigators for the Federal Marketplace Health Insurance Plan, the Affordable Care Act, colloquially referred to as Obamacare. We have a team of licensed navigators in English and in Spanish, and all of that is accessible on our website. I'm going to just say the numbers, but I will put it in there. My main number at AHEC is 850-224-1177. Thank you, and we are available at any time on our website to reach out to us. Appreciate the time.
Awesome. Thank you so much, Yolanda, for sharing those services. Again, if you are tuning in recently, the information will be sent via an electronic packet no later than next week. So be on the lookout for that. Next, we have up Help Me Grow. Amber from Help Me Grow in 211 Big Bend. Okay, there you go.
All right, sorry. So I kind of have a few things to go over. I am, like you said, I'm Amber Freeman. I'm the Help Me Grow program coordinator at 211 Big Bend. So I just kind of wanted to go through an overview of all the things that 211 Big Bend actually does. We have a bunch of different programs. I'm going to share our website just because we have so much going on. I thought it may be helpful for you guys to see wherever the website is. Oh, right. Nope. Okay. So this is our new website for 211, and we have a lot of different programs. Of course, we're the hotline, the 24-hour crisis counseling information and referral hotline. So whether you are in a crisis and need to talk to someone, or if you need a referral to like a food pantry, 211 kind of knows everything. There's also the suicide prevention hotline. We answer the statewide Florida HIV and AIDS, as well as the statewide family health line. And then we also do the veteran lift program, or no, the veteran program, and then the lift program, which I obviously can't find. So I'm with Help Me Grow. And so this is our little page. we provide free behavior and developmental screenings for kids 0 to 8. So our screenings can be about like their behavior development, their social emotional interactions. And then we also do an autism checklist. We then can talk to families and we provide care coordination. So we work with the families to get them referred, whether that be to a community agency that serves kids or another agency for food or rent assistance. And that's why it's so great that we are with 211, because we can use their referrals as well. We keep up with families for months and months and rescreen their children at the different age intervals. And it's just a really great way to see if kids are on track for their age, if there is any concern, and then advocating for them to make sure they get connected to services. So it's pretty good overview for kids 0 to 8. And we really do ensure that the kids that we serve and families that we serve get those screenings. If there isn't a concern, we'll still provide services and education information. And it's just really great to make sure all kids are on track for their age and developing correctly. So you can actually contact us in a lot of ways. There is a contact us at the top of the website, where you can put like your name, your email. And then if you're trying to contact Help Me Grow, you would click on that. And then it'll come to, I think it comes directly to me, and then I'll be able to follow up with you guys. You can also, for Help Me Grow specifically, you can go to complete a free screening online. And this is actually where parents can go and just easily do a screening online. Usually we do screenings over the phone, which is super easy for parents, right? Because they don't have to get, childcare or transportation. We can do it over the phone. They can do it over the internet. And so it's super easy for parents as well. That is a super brief overview of everything that we kind of cover. And I hope it is helpful. I would throw up my, since I have a little time. So we partner with the CDC for the Learn to Act Early, and they provide us with a lot of great material. And we do have the virtual checklist, which is a short little checklist that parents can do to see how they're doing. So that's also always on our website with the CDC. I'm going to stop sharing, and hopefully if you guys need me, I'll put my contact information in the chat, and I can help you guys kind of navigate which program that you're looking for, but especially with the Help Me Grow program. So thank you.
Thanks, Amber. We're going to share your video really quick.
Oh yeah, so sorry. So this is just a super short video to kind of show the relationship between 211 and Help Me Grow.
The Help Me Grow advocates are able to plug in to this resource directory and access whatever services that family needs. And then Help Me Grow is able to really work with the children on their developmental stages.
Thank you for calling 211 Help Me Grow. This is Cynthia. How can I help you?
If you are worried about something that you don't want to share with anybody, you can call, and you don't have to give us your name. You can just ask, here's what's going on. Could you tell me about this? Or I'm worried about that, or I'm nervous about that. You don't have to share any more than you want to share.
Thank you. So that's just a short video of how 211 and Help Me Grow work so well together. But again, I'll put my info in the chat, and if you guys need anything or have any questions, let me know.
Great. Thank you so much, Amber, for sharing all the great resources at 211 and Help Me Grow. Next we have up is Liberty Dental.
Hi everyone. I would like to introduce myself. My name is Vanessa Kelly. I am the Dental Wellness Coordinator and a registered dental hygienist for Liberty Dental Plan. Our goal at Liberty is to be the industry leader in increasing dental health awareness and with the utmost focus on improving our members' oral health outcome across the lifespan. Liberty Dental Plan's Dental Wellness has an outreach program that provides education and learning tools on dental health for children that need it the most. I have the pleasure of attending community events, public schools, daycares, and virtual events to educate the public on dental health and provide those dental resources for both children and adults. The Dental Wellness Outreach Program also provides free oral health screenings and application of fluoride varnish for children to help improve their overall health. As children grow and develop, it is very important that they are taught about oral hygiene care. School-age children also need techniques on brushing and flossing for proper care of their teeth. Creating exposure to dental instruments. Of course, when I do screenings, I use a mirror and a light. And all these materials will help develop a greater experience once the child receives care at an actual dental clinic. Familiarizing things for the children make their first dental visit much more successful. I also have for you all some tips for a healthy smile, of course. Brushing 2 times a day is very important, of course, with an electric toothbrush compared to a manual toothbrush. Making sure we are brushing our teeth at a 45-degree angle. That way we're getting the head of the toothbrush on the gum as well as the tooth. And of course, slowly, not too fast. If you brush really, really fast, of course, it can cause our gums to recede. And that's basically you're showing more tooth than you are gum tissue. Another thing is brushing our tongue gently, of course, to remove plaque and bacteria and to freshen your breath. You would want to use a gently sweeping motion, of course, no scrubbing. And last but not least, flossing. I know that's very fun. At least once a day. I always recommend at least using floss picks and using at least 4 or 5 of them. You don't want to use one floss pick for the whole mouth, because with that small piece of floss, you're spreading your germs in between every single tooth. So make sure we're using those floss picks at least once a day, and we are making the shape of a letter C to get the side of that tooth and to remove that excess bacteria and plaque. Thank you all so much for your attention. Please, if you have any questions, feel free to contact me. I will add my information here in the chat box. Of course, if you have any questions about Liberty Dental Plan Insurance, I will also leave our website on the chat box as well. Thank you.
Thank you, Vanessa. Great information and resources available at Liberty. And thank you for sharing those tips. And so families, again, information will be shared sometime, well, no later than next week on different resources that were shared. So if you're interested in the Liberty information, we will definitely be sending that out. So up next, we have Spark Pediatric. Hal, you're on mute. There you go.
I'm sorry. It's been one of them days. First, thank you for helping me this morning, Miss Paige. My name is Hal Brick. I'm with Spark Pediatrics. I'm the Business Development Director in North Florida, Jacksonville, and Tallahassee. I'm going to give you a presentation so we can go into it, and y'all can ask me questions as we go along. Now, can y'all see this? Are you able to see this?
No, not yet.
How about now?
All right, look like we have something up now.
Okay, are you able to see it?
Yes, we can see it. Thank you.
Okay.
So Hal, I'm actually sharing my screen, so you'll have to tell me when to move on to the next slide.
Okay. So you're okay. Anyway, by terminology, we're a medical daycare. A lot of people might have heard of the term PPAC in the areas. Go ahead to the next one. Did it go?
You're on what is PPAC?
Okay, go to the next one.
Okay, you are who can receive services?
Right, okay.
I don't see it on Cara, can you put it in presentation? I don't see it on my end. I saw the main slide.
Okay, 1 second. Let me reshare it.
Okay. There we go. Perfect. Who can receive services? You're on, Hal. Back to
Okay, so we see children from infants all the way to 21. We have 13 locations throughout the state of Florida. And who can receive this? Any children with special medical complex needs. That's from preemies all the way up to ventilators, trachs, G2s, anything that has to do with a nursing need. This can be short-term, long-term. I work with Newmore's here in Jacksonville, and we are doing antibiotics with a child with a Brotabat, like a PICC line. So from studies shows that using our service, we can do a lot without readmitting the child, and that cuts the cost down. With the needs that a lot of regular daycare can't meet these needs, and a lot of regular daycares can't meet these needs with mothers with children with certain medical complex needs. Go ahead to the next slide. Most of the children that we see are with us between 4 to 5 hours a day, but we're open from 6 to 6, Monday through Friday. To benefit the program, we at least need 4.25 hours to benefit, because most of these children, about 99%, get therapy service at the same time, all the way from PT, OT, physical therapy, and even sign language here in Jacksonville. We teamed up with the School for the Deaf and Blind, and I have a couple of children with trachs, and that's helped tremendously with the parents to communicate with the child. We accept all managed medical assistance from Medicaid, HMOs, CMS, and even some private insurance in and out of network. Go ahead. And I'm going to see if I can play this video for you. If not, I'll have a link to send you. This gives you an overview from 2021. Are you able to see that?
No,
Yes.
you'll have to share the screen, Hal.
Okay. Well, I guess it's not playing. Let's see. All right, I'll send that to y'all because I know we're pressed for time on that area. Okay, next slide, please. Next slide, please. Some of the stories I can tell you, I had one child who has CP, and he was diagnosed with CP at a young age, and with the therapy, he is walking now. Sammy, he's one of our ones that's been there the longest. And a lot of these children that come to our centers, they graduate and continue on to a regular daycare. Go ahead. And these are some of the diagnoses I mentioned earlier. We see children with asthma, seizure disorder, failure to thrive. I've been seeing a lot of failure to thrive and child development delays since the COVID started, because a lot of the parents kept the children at home, and that's where the children are not getting their motor skills when they're interacting with other children. So that's one of the biggest diagnoses I've seen weekly. One of the things that people probably ask me every day is behavioral. We see children with certain behaviorals, but they have a nursing need that go along with the behavioral. Now, if the child doesn't qualify with us as strictly behavioral, I've come across a lot of resources in Tallahassee that can help these mothers and place these children so we don't leave the mothers, because that's one of the biggest issues that I'm coming across each day, and I don't want to leave the parents not able to go anywhere. Go ahead. How to refer the child. I have my contact information after this. You contact me, and one of the things I need to get is the name of the child, the date of birth, etc., the name of the pediatrician, what the diagnosis is, etc. And you can always contact me anytime after hours. Go ahead. And this is my contact information. I'm in North Florida. That was a little area, Central Florida, but I'm in North Florida. I usually commute to Tallahassee a couple times a month. We have 2 centers in Jacksonville, 1 in Tallahassee. We were over off the southwest part of Tallahassee. My medical director is Dr. Thomas Truman at Tallahassee Memorial Hospital. He's really a good guy. He's always very reachable. Next slide, please. And these are some of our centers that's throughout Florida. Gives you an idea. I always say when we have referral, I always like to bring the children into the center because we have to work up a care plan and always do the tours so the parents can see it. We all learn different, and I've always said that seeing it and saying it's two different things. So I'm letting y'all know the door's always open if anybody ever wants to do a tour. Go ahead. And that's my Sammy I was telling you about. Sammy's a lot bigger now. They grow very quickly and they change very quickly. And he is walking, and I think it's great. Do y'all have any questions? Any questions?
We'll take all questions at the end during our Q&A. So
Okay.
if anyone does have a question, please put it in the Q&A chat or the Facebook chat, and then we'll get back with you, Hal, at the end.
Okay, and I'll send y'all the link of the 30-second video of overlook of 2021.
Okay, perfect. Thank you. All right. Thanks again for sharing all the great things you all have at Spark Pediatric. Up next, we have Healthy Start. Tanya Bell with Healthy Start sharing the Connect program. Take it away, Tanya.
Good afternoon. Thank you first of all, for inviting us to be a part of this virtual health fair. As stated, I'm Tanya Bell with Healthy Start Coalition, serving Jefferson, Madison, and Taylor counties. Because of course, every baby deserves a healthy start. Our Healthy Start program is a voluntary statewide program available to all pregnant women and infants in the state of Florida. The program assists pregnant women and infants in accessing prenatal and infant health care and other services necessary to reduce the risk of low birth weight, premature birth, fetal and infant mortality, and promote healthy development. Our Healthy Start Coalition of Jefferson, Madison, and Taylor counties, of course, we contract with Florida Department of Health and Taylor, Madison, and Jefferson counties to provide care coordination services to all the clients of the Jefferson, Madison, Taylor counties. The Healthy Start coordinators, they work closely with the clients, the families, the medical providers, and the community agencies, whether it be WIC, whether it be school health, refuge house, other community partners as well. And one of the underlying principles of the Healthy Start program, of course, statewide, is community engagement and collaboration. And of course, we participate with all of those. And some of the services provided from Healthy Start is information and education, of course, infant safety education, breastfeeding support and education, home visiting, free childbirth classing, nutritional information, smoking cessation education and support, community referrals, parenting and baby care, developmental screenings, family planning, car seat classes, and of course, a host of resources in the community. What I do for the most of it is promote our Connect program. I'm pretty sure a lot of you have seen me out in the community talking about our one-door entry into services. And of course, that's what our Connect program is about. Our Connect program is a statewide program that's geared toward engaging our pregnant women and infants into a one-door entry. And that entry kind of consists of our Healthy Start programs, our Healthy Family programs, and of course, our Early Head Start. Within those programs, we try to promote to make sure that the parent is receiving the services that they need in order for the baby and the parent to be healthy. Going back into those programs with our Early Head Start, of course, we give them the options to choose whether they decide they want to deal more with school readiness, or if they want to deal more with the Healthy Families programs. Of course, our Healthy Start program and our Healthy Families program. A Healthy Families program is a community-based volunteer home visiting program as well. And it's kind of designed to support and educate the parents throughout the first years of the life. Of course, the first 5 years is very, very important for the developmental of the kids. So they get that option to choose which of those home visiting programs that they would be interested in. And if they're not interested in those home visiting programs, we always refer them to other community programs that's available to them. So that being said, we want to make sure that all of our parents and infants are striving and thriving to be the best that they can possibly be. And in the event, if anyone would like to be referred into our program, they can come in and do a self-referral. That means that they're pregnant or have children. They can come to me directly. We have 3 coordinators, I'm sorry. We have a person in the Taylor area, Ms. Sarah Bays. We also have Ms. Laura Blue in the Jefferson Madison area, and myself, Tanya, in the Jefferson Madison area, that we deal with these clients with our Connect program. So in the event, if they want to get into our program, they can contact any of us and we can make sure that we facilitate them through that one-door entry versus them having to go and be alone and try to facilitate themselves. And my contact information, and I also put it in the chat box, is area code 850-253-5355. And again, if you have any families or know of any families that we could possibly assist, please send them to our program and we can get them through our process. Thank you.
Thank you, Tanya, for sharing those resources. And yes, every baby deserves a healthy start. So thank you. Up next, we have Paige Stewart with Safe Kids and TMH.
Good afternoon, everyone. I have a presentation to share. Okay, so hello, everyone. Again, my name is Paige Stewart, and I am a child health educator here at TMH. I also serve as the Safe Kids Big Bang coordinator, and today I will be sharing some information with you all about the organization Safe Kids. So the sole mission and purpose of Safe Kids is to keep all kids safe from preventable injuries. Some of the most common preventable injuries are motor vehicle crashes, suffocation, drowning, poisoning, pedestrian accidents, fires, and burns. And preventable injuries are the #1 killer of kids in the US, and millions of children are injured every year. So our role as Safe Kids is to not necessarily sell a certain service, but to just educate families and aid in changing behaviors. With more children dying from preventable injuries than homicide, suicide, and cancer combined, these outstanding numbers are the reason that Safe Kids worldwide exists today, as well as the local coalitions. And each coalition is led by a local organization, such as a hospital, a health department, or other community-based organizations. And our local coalition in Leon County is led by TMH. Safe Kids provides resources to deliver community programs in various areas such as safe sleep, water safety, sport safety, and pedestrian safety. And through collaboration with our coalition partners and other Safe Kids coalitions across the state, we're able to implement programs that address the leading causes of unintentional injuries and deaths and help to lower those injury counts as well as death counts. So if you know of anyone who would like more information on any of those particular safety topics that were listed, or other programs that we have or are able to put on for camps or any other areas that you feel may need that information, please feel free to reach out to me. My information is on the screen. Again, I thank you for your time and thank you ELC for having us today.
Thank you so much, Paige, for sharing that information and those resources available. We're going to keep moving right along. Up next, we have Safe Families. I believe it's Kathy Campbell with Safe Families.
Yep, I'm here. Sorry about that. I'm Kathy Campbell from Safe Families for Children. I'm our local director. And what we do is we are an organization that empowers and equips volunteers in our community to come alongside families who need social support. So these are families who are in social isolation, They don't have the extended care and support network that many of us enjoy. And so we come alongside people in our community who want to be a help to their neighbors. We train, screen, and also cover their interactions with liability insurance. But these volunteers are able to help that parent often move forward because of barriers that they can't overcome by themselves. I mean, obviously, all of us have those in our lives where we need a little help from a friend. And that's exactly what we offer parents, is a family friend. And that family friend is working with a team of others, a family coach, resource friends, and even host families who can let their children or child land in their home for a little while. It's just very much the way an extended family member may allow your child to come to their home and stay for a weekend to give mom a much needed mental health break, as far as respite care, or a longer period of time when the family is facing some sort of crisis. We come alongside families who are experiencing all kinds of things, from grandparents who are kinship care providers who want to take a cruise, we've hosted for that reason, to families who are homeless, and that while they are okay with, well, the parents are okay with sleeping in their car, they don't want their child to experience that. And so our host families can host for up to 6 months, but oftentimes it's a much shorter period of time. Right now, I'm personally, you may hear some baby talk in the background. I'm hosting for a mom who's at the hospital having this child's sibling, and she just didn't have extended family in our area who could do that for her. I would say hosting is a small part of what we do. A big part of what we do is all of these wonderful providers who you're hearing from, oftentimes families, because of trauma issues, because of just barriers. Again, families can't connect to these resources. And that's where our family friend really can come into place. Whether it's transportation, childcare, or some other need the family just can't find help for anywhere else, our volunteers are able to crowdsource their community and try to find what will help that parent overcome that obstacle. I like to think of us as the last mile deliveries in the delivery system, right? A lot of these other providers are helping navigate, they're providing services, and we're holding that parent's hand and figuring out why they can't connect to these services in a friend way. And sometimes that's because of trauma issues where, if they get a voicemail, it's really difficult to overcome seeing that as rejection, or if they don't get a call back or a response. If they try to fill out a form, but their kiddo dropped their phone last week and DocuSign or whatever the app they're trying to use is not wanting to cooperate with their phone. We're going to try to help them figure that out and help them figure it out while we're relationally supporting them. A lot of what our volunteers do is being that cheerleader that everybody needs, that we know you can do it. We know you're the parent, you're the person who's best equipped to care for your child. And we know that with a little help from your friends, you are going to be able to do a great job. And so these relationships, our goal is that they're long-term, that the parent can come back again and again and use this volunteer as that phone number they have in their phone that they can call in case of emergency. And those volunteers, eventually what we see a lot of with the parents and volunteers who we're coming alongside and equipping to have that relationship, they take their relationship, we call it a natural relationship. It evolves into that where they tell us, we don't need you guys anymore. This is good. This is family now. And that's a happy day. That's like our only program that we have. And that's the outcome we hope for most. If you need help yourself or someone who could use help, Our website is safefamilies.org. There's a dash between safe and families, and there is a little form on there that says you need help, and you fill out that form. And Tallahassee is our local chapter. We've been here for about a year, and we will get that information and we will reach out to that parent or to you as quickly as possible. And we, really, like I said, that support and that community support is really what we do. And so we wrap around any other services or programs families are involved in, and just trying to help them be successful in those programs and services. Thank you so much for your time. And I look forward to talking to more of you and seeing how we can support the families that are your neighbors or that you're working with.
Great. Thank you so much, Kathy. We're gonna try to move along. I know we're just a little bit behind on time, but we're gonna keep pushing, and we're gonna have the Kearney Center up next.
Hi everyone, I'm Chloe. I'm the supportive program supervisor here at the Kearney Center. I have a short presentation that I'm going to share with you guys. Give me 1 second. So here at the Kearney Center, our mission is to offer help and hope by creating solutions that provide a path to self-sufficiency to those in poverty. In service to this mission, we are committed to providing a safe environment that promotes dignity and respect. We are an emergency shelter here in the Tallahassee area, and I wanted to just start off by providing a few statistics about homelessness in our area. According to the National Alliance to End Homelessness, there are 27,487 people who experience homelessness on any given night in the state of Florida. And in our Tallahassee, Leon County area, there are about 805 people that experience homelessness on any given night. So we can see that it's a pretty prevalent issue in our communities. The Kearney Center provides temporary emergency shelter services to individuals ages 18 and older. We cannot accept any pets, minors, or individuals required to register as sex offenders. And shelter guests must be able to complete activities of daily living independently. So if somebody needs assistance, say showering, walking, anything of that nature, we're not able to accept them into our program. And we currently have a capacity of 258 guests on a nightly basis. If you or yourself know anyone that and meets the previously mentioned criteria, they should call our emergency services line at the number listed on this slide. One of our intake staff members will assess the individual for services and attempt to identify a safe or appropriate alternative to emergency shelter if the individual has one. If no alternative is identified, the staff will then complete all the necessary intake paperwork with the individual. If they don't have regular access to a phone, they are welcome to come to the Kearney Center Monday through Friday during the hours of 9 to 5 so that they can speak with intake staff. Due to high need and a limited capacity, intake is dependent on bed availability, and it is first come, first serve. So we do walk-up intake every Monday, Tuesday, Thursday, and Friday at 10 a.m. and 3 p.m. So people can come an hour before that time to sign up for a shelter bed, and we'll cut off the sign up when we fill the available beds for the. So we also aim to divert as many individuals from shelter as possible. So that means working with people to identify safe and appropriate alternatives to shelter, whether that is a friend or a family member outside of the area. We can get them a bus ticket to them, whether that's paying some move-in costs for someone or mediating with a family member so that they can stay with them temporarily. Just trying to identify any alternative someone may have to shelter, which allows us to keep the shelter beds available for true emergencies and individuals who we cannot identify an alternative for. It is a grant-funded program, so we're hoping to get the grant again next year. But we've had it for the last 2 years, so it's a pretty robust program at this point. We're a housing focused shelter. So from intake to exit, all services are centered around housing. We have different partner agencies that come into our facility and provide assistance such as legal aid, DCF, victim advocacy. And then our in-house case management team works with shelter guests to help them identify permanent and stable housing. So our case management team does just the housing component, and then they refer to all these other providers that come into our building so that clients can access all services under one roof. We also have an in-house rapid rehousing program which assists individuals with short-term rental assistance and supportive services so that they can quickly end their homelessness and return to permanent housing. If you want to know how you can get involved, we are now accepting volunteers at the Kearney Center. We do require that volunteers wear masks while in our building. For students, organizations, and individuals who would like to volunteer, I invite you all to send an email to Keith Bythewood. He is our interim volunteer coordinator. We are in the process of bringing on a new coordinator, but she's not settled yet. So right now we can still direct all inquiries to Keith, and he will be happy to reach back out to you and schedule some time for you to come in and volunteer. If you're interested in volunteering in the kitchen, you can reach out to Douglas Sutton. He is our food services director, and he schedules all of the kitchen serving shifts. We also do offer court-ordered community service. So if you are required to complete community service hours, you're welcome to give us a call, and we will get you some information on the orientation process and how to get that process started. And that is all I have for you guys today. Thank you so much.
Thanks, Chloe. Thank you so much for sharing those resources at the Kearney Center. Have we been raising the roof, or have we been raising the roof with these resources? With, thank you, my DJ. But as we take a quick break, we're going to do a trivia in the midst of this. So if there's any panelists or anyone that need to use the restroom, go ahead. But we want our attendees that are on Facebook Live and Zoom to stay with us for a quick second. We're going to do a trivia. This first trivia is going to be in Zoom, and it's the first correct answer, okay? If we have any ELC staff, you are not allowed to play. So hold back your fingers, make sure you are not entering into the chats. All right, the first question, what 7 counties does ELC of the Big Bend serve? So we want you to make it quick. I talked about it earlier in the presentation, the 7 counties that ELC serves. And I'm not looking in the chat. Let's see. Are we getting? I think we have a chat monitor that'll be taking a look for us and sharing the information. And who's the first to get that? All right. For our trivia for Facebook, we're going to keep moving, but feel free in Zoom to put that in the chat. For Facebook, the first question, name 3 of the core services that ELC offers. 3 of the core services that ELC offers. I can't see, so my chat monitors, please share any winners that we may have. All right, thank you all for playing. We, since time, we don't want time to pass us on. We'll give it 1 more minute and then we'll get started from our quick intermission with the Hang Tough Foundation. So Janelle, just be prepared, but we're not going to call on you yet. We're going to give it 1 minute. We're going to share our winners at the end. So if you can just hang tight and be patient. And Janelle, are you ready from Hang Tough?
Yes, ma'am, I am.
All right, take it away.
All right, perfect. Thank you so much for ELC for giving us this opportunity to share who we are and what we do. Very, very grateful for the opportunity. So just real quick, Hang Tough Foundation, we are a local nonprofit that's established to serve families with children who have special needs or childhood illness. What we have found during our journey and during our research is that the entire family, when a diagnosis comes in for a child, it affects everybody in that family unit. And a lot of times you have to go many places to get the services you need to try to keep everybody strong and intact and together during their journey. And so we created the Hang Tough Foundation 7 years ago to start putting all of that under one umbrella and to really give families an opportunity to come to a one-stop shop where they can get resources for every family member. So we serve families that have kids ages 0 to 21 with any type of childhood illness or special needs. Because we don't take care of the medical needs of the child and we take care of the emotional part of the family aspect, that diagnosis is almost just the caveat to become part of our family. And what we do once a family signs up to be a part of our big extended family, as we add you to our private family Facebook group where you can connect with other families that are going through very similar journeys as you and build some really strong relationships where people can support one another. And that all happens organically as families come together and just support one another and share their experiences. But we also offer 10 programs and services, all available at no cost to the families that we serve. I almost call it like a concierge service where families can pick and choose what they need at the moment. They may not need a service at one time, but maybe 2 years down the road they do. So just a quick sampling of everything that we do. We do parents' night out opportunities to give the parents a little bit of respite time where we can love and play on the kids, make sure we have medical expertise there, make sure we have special education gurus to watch those kiddos, but give those parents a much deserved break. We do support groups and we'll do childcare during those events. We offer tutoring services. We offer a sibling support program where we take the kids that do not have a diagnosis that oftentimes get put on the back burner or don't get as much attention as their sibling that does have a diagnosis, put them on a pedestal, love on them for a little bit and let them know how loved and how important they are to their family cycle. We also do family fun events where many of these kids cannot do some of the typical things that are out in our community, like going to Skate World or going to Fun Station. Well, we'll turn down lights, we'll turn down music, we'll clean the place beforehand so our immunocompromised friends can come, and we make sure that every child gets those experiences that every kiddo deserves. We do the same thing with our big Santa Day program in December, making sure every kid that wants an opportunity to visit with Santa has an opportunity to do so. Just some very simple things. I often say what we do is not rocket science. It's literally providing families opportunities to be together, to grow together, and to make sure they're strong and intact during their journey. And so that is a very brief overview of what Hang Tough Foundation does. But if you have any questions, I'm going to put my information in the chat and let you reach out to me. But for families, it's quick and easy to sign up. You just visit our website at hangtoughfoundation.org and you sign up right then and there. And you're welcomed with open arms into our family. You'll receive a welcome package and you'll start getting a newsletter that lists all of these events and you can sign up for what you'd like to partake in. So again, thank you so much, ELC, for the opportunity. It's been great hearing all about all these other organizations too. So thanks so much, guys.
Yes, thank you again, Janelle. Thank you. Up next, we have Unite Us. I believe it's Katie.
Katie had to jump off so we can move to the next one.
Okay. All right. Capital Area Community Action. Are you here with us?
I think it's Lighthouse of the Big Ben.
Okay. Lighthouse.
Yes, Lighthouse is here. Sorry.
Perfect. Thank you.
Give me just 1 second. You caught me off guard.
That's okay. We have your presentation up and ready for you.
Oh, okay. Good afternoon. Again, thank you for the invitation. We are happy to be part of this. I am Deborah Jump. I'm the Director of Development at Lighthouse of the Big Bend, also known as LBB. We are not Lighthouse Children's Home. We do not take in furniture or other things donated. That is a completely different organization, so not to be confused with that. LBB, we work with individuals who are blind or visually impaired from birth to seniors. So that covers this category. We serve 11 counties from Franklin County, which is basically Apalachicola, all the way over to Suwannee County, which is Live Oak. So it's 11 counties, very wide radius. Our specialists focus on helping our clients maintain their quality of life by helping them to learn and accomplish tasks and adjust to their vision loss. We do this through one-on-one counseling, as well as providing a variety of peer support groups. Our services are free to our clients. And in addition to our adult programs, which I won't spend a lot of time on today, although some of the things you'll see cover adults, we have programs for babies from birth to 6 years old. Our children's program is for ages 7 to 14, and our transition program is for students ages 15 to 22. For our babies, a specialist trains children in the areas of child development, such as communicative, daily living, sensory and motor, and cognitive development services are offered to both the children and their families. We don't focus just on the babies. We focus on teaching the parents how to work with their children as well. Early intervention specialists offer instruction in the home, at daycare, at school, or in the community, wherever it is needed. And of course, early intervention, as we all know, is crucial in preventing developmental delays due to visual impairments. We create a specialized service plan for each child to meet their individual goals and needs. The child specialist reviews the service plan with their family and then provides ongoing communication on the child's progress. Our services, I think there's a screen. The next screen is, there we go. Our services include teaching techniques and daily living skills, including eating, cleaning, and maintaining personal hygiene. Examples of some of these for a younger child are something as simple as brushing their teeth, picking up toys, feeding themselves, and or dressing themselves. Since children who are visually impaired or blind cannot learn through visual observation, our specialists teach these skills through hands-on practice and experiences. In regards to communication, we teach things such as Braille, which is a tactile reading and writing system consisting of raised dots. Braille can be used in most languages. We had a young child, probably 4th or 5th grade, that was attending our summer camp yesterday, and watching him read using Braille and the speed at which he did it was amazing. And he was one that had obviously early intervention. So that's just a good example of that. Assistive technology, this is going to be for our older adults, of course, or not older adults, but our adults. A smartphone is a perfect example of assistive technology, which offers numerous apps to assist an individual with a visual impairment. And of course, this is for our older adults, our older clients. Orientation and mobility teaches basic understanding of the environment to the child and the techniques on how to travel efficiently, safely, and independently, which of course may include a white cane. Recreation and leisure activities. This could be something as simple as listening to an audiobook. And the last one is individual and family adjustment counseling, which we also do, which, as you can imagine, is very important. LBB's primary focus is to help individuals with a visual impairment be independent and live a fulfilling life. And I kept it simple. That's all we have. We welcome any questions later on.
Yes, thank you, Deborah, for sharing that information. And for the
Absolutely.
time, we're just going to keep moving. Next up is Whole Child Leon. Whole Child Leon.
Good morning. Thank you all so much for having me. I have a brief PowerPoint. Let me see if I can share that with you all. So hi, everyone. My name is Charlie Jackson, and I serve as the Regional Advocate for Whole Child Leon, which is a provider of the Open Doors Outreach Network. And as a member of the Open Doors Outreach team, we work with children and young adults ages 10 to 24 who are verified or suspected victims of human sex trafficking and commercial sexual exploitation here in the Big Bend area. The 8 counties that we cover include Leon, Gadsden, Wakulla, Franklin, Madison, Liberty, Taylor, and Jefferson counties. And oftentimes when many of us hear the term human sex trafficking, we immediately think of the film Taken. However, just working in our local communities, that is a form of trafficking that we rarely see. What we often see are young people who have been trafficked by intimate partners, their boyfriends, their girlfriends, individuals that they've met online. We're working with young people who have been trafficked by family members. We have a client who was unfortunately trafficked by a mom who struggles with an addiction. Someone offered mom some illegal substances in exchange for alone time with her 14-year-old in a hotel. And even though this occurred only once, the moment that exchange took place, that young lady became a victim of trafficking and her mother became her trafficker. So I just wanted to emphasize that for anyone who might have a narrow perception of what trafficking looks like. We also provide services to young people who are engaging in high-risk behaviors that could put them at risk of coming into contact with a trafficker. So for example, we work with young people who have been sharing some inappropriate images of themselves on social media with strangers. Now, when it comes to our services, we provide trauma-informed, survivor-centered services, which includes individual counseling and group counseling. Each one of our participants is connected with a survivor mentor. We offer crisis intervention. A member of our outreach team is available 24 hours a day, 7 days a week through our toll-free hotline. We also offer personal advocacy and court advocacy. A recent example of our court advocacy is our clinician was able to serve and provide expert witness testimony on behalf of one of our clients in a federal trial. An example of personal advocacy is I was able to assist a young survivor with applying for Job Corps, and I was able to assist another one with registering for a GED program. Something that's not included in the slide is a program that we're actually really excited about. Recently, we received funding for a 3-year housing assistance program, and I am here to say that this program is a game changer for some of our folks. We're able to pay up to 12 months of full rent payments for participants ages 18 to 24, as long as they're demonstrating that they're working towards sustainability. And like I said, this is life-changing. I'm excited to share that we are assisting a mom locally. And so this is allowing her, after she has exited that lifestyle, this is allowing her to work full-time, take care of her 3-year-old, as she also works on getting her GED. So we're really excited to be able to do that for our participants. And as you can just see by, the services that I have listed, Open Doors is really aimed at providing those wraparound services for the most vulnerable young people that we have out here in our communities. Now, who comprises of the Open Doors outreach team? I apologize, this slide looks much better on my end, but our Open Doors outreach team consists of myself, the regional advocate, and my role is to just connect our clients with the community supports and resources that best fit their individual needs. I also serve as a liaison between myself and our program in the community. We also have our clinician, Sarah Farmer, and our clinician helps to ensure that our clients receive free counseling services. And I often brag about Sarah because not only is she licensed, but she's also certified in EMDR. And for anyone who works with young people, you know that when it comes to traditional counseling methods, they are often very resistant and hesitant. And Sarah has this way of utilizing expressive therapy to help connect with our clients, such as using art, using music, using poetry. And we have found this to be very successful in working with this population. Our team also consists of a survivor mentor. Our survivor mentor is Robin Silberman. And Robin has a very unique lived experience that allows her to form a unique bond with our clients. And what's important about this is it allows them to form a healthy relationship with a safe and caring adult. Our other team member is Cory Mcgooden. She serves as the victim service coordinator, and that role simply serves as a supervisor for the rest of the team. So if you have any questions about Open Doors, our services, our housing assistance program, please don't hesitate to include it in the chat. Or if you would like to submit a referral on behalf of someone, you can contact us directly. Thank you.
Thank you so much, Charlie. Thank you so much. All right, moving along. Up next, we have Careersource Capital Region. Robin from Careersource Capital Region.
Hello, everyone. Thank you so much for inviting us here today. We're excited about being here. Let me share our screen. Okay, so we're going to run through this program like nobody's business. Can we see it?
Yes, we can.
Okay, so Careersource Capital Region, solutions that work for you. What we do, we connect employers with qualified skilled talent, Floridians with employment and career development. We do that on a mainframe called Employ Florida. It has resources throughout the state of Florida. In 2015-16, our governor combined the names, and so all areas are represented, 26 areas are represented, and they're called Careersource Brevard, Careersource Capital Region, etc. We use this platform to create and send resumes, search for jobs, labor market information, and assess your job skills. For school assistance, we offer up to $10,000 through our WIOA program for tuition fees, books, supplies, uniforms, shoes, certifications. It's a real hot program here in our local area. Tools we use, career counseling, skills, interests, assessments. Next slide, please. This is the slide that I was on, up to $10,000. Next slide. Next slide. Popular training in our area, Region 5, commercial truck driving, welding, correctional officers, nursing assistants, phlebotomy. Those are some of the hot career opportunities. Next slide. Work experience will be up and running July 1st. We're in the middle of a provider change, so look to hear more from us on that. Veterans, a little bit more about apprenticeships. We're on the ground and running with that. Some of our local apprenticeship opportunities, Leon County student apprenticeships, information technology, high-tech manufacturing, construction, automotive repair at this time. Next slide, please. Veterans, thank you for your service. Priority of service is given to our veterans. So for instance, if a veteran comes in and we're only have 2 slots available, the veteran gets the priority of the service. We have local DevOps to help our veterans that have disabilities. Slide, returning citizens. There's a big surge for those people in re-entry. We provide supportive services, job search assistance, and a federal bonding program. This federal bonding program is for at-risk career seekers, ex-offenders, persons that are recovering from substance abuse, alcohol, drugs, welfare recipients, maybe your credit score is low, economically disadvantaged youth and adults. Next slide, please. We also service those persons with a 5-year professional experience or higher degrees, masters, PhDs, doctorates, etc. We do mock interviewing, job search strategies, networking, job referrals. Next slide, please. Events. We're really known for our mass recruitment events, and we partner with a lot of persons that are on this call right now to make sure that they have some talent in their centers. Next slide. Our social media, you can follow us at Careersource Capital Region. If you want to take your phone out, you can do that. Questions at the end, contact us. Our website is full of all of this information that I've just sped through for you, www.careersourcecapitalregion.com, or you can reach us via phone 850-922-0023. Thank you so much for the opportunity. Have a great day, everyone.
Thank you so much, Robin, for sharing those resources really quick. Up next, we have Diane Head with Careersource North Florida. Let's see if you can beat Robin's time, just in respect for time. We have just a couple minutes left. So if you can keep it high level for us, Diane.
Yeah, I am going to show you two things because everything that Robin said, I can just say ditto, right? Except for we serve Hamilton, Jefferson, Lafayette, Madison, Suwannee, and Taylor counties. So for those of you in the western part of the ELC region, you fall under us. Although if you're coming from Tallahassee, we're certainly happy to help, just like Robin will help you if you live in Jefferson County and want to go to Tallahassee to receive services. We're friends and we like each other and we work together often. But what I'm showing you right now is our website. So you can go on and you can book an appointment right there on the front page. You don't have to go any further. You can book an appointment here in our office, or you can just send us an email. That email, it comes to me. I'm going to get it and staff it out, and someone will be in touch with you within next time we come into the office. So if you send it at 2:00 in the morning, we get a lot of those. We will address it when we get in the next business day. All of our pertinent information is right there on the front page. I did just want to show you real quick, if you navigate on our website, maybe, there we go. You can actually see a whole listing of our jobs here in the middle. You can expand it and make it bigger so you can actually read it. And we update that twice a week, but all of that information comes over from Employee Florida. And then also down at the bottom of this page are our locations and where you can find us. We have our comprehensive one-stop here in Madison, 705 East Bay Street. We are in Perry, inside of Big Bend Technical College. It does say the mobile center, but we're trying something new at Big Bend, so you can actually come inside the building and see us there. We are in Monticello on Wednesdays, and I think that covers this region. And then if, like Robin indicated, we do have training scholarships. You can apply right on our website. Again, if my internet wants to work today. And all the information you need is on the career and training services page of our website. And you can actually click and apply right there. And what else did I want to show you? Something new that we're doing. We have our staff. You can actually reach them from our About page on our website, which is really cool. If you want to be in touch with someone in particular, you can reach out to them straight from there. If you're interested in working for us because we're so awesome and wonderful, we would love to have you join our team, and you can actually upload your resume here. We also have a new Career Channels podcast, so you can learn a little bit more about our services. It is brand new, so we have just a handful of episodes up, so we really haven't promoted it. So this is kind of where we're pushing it out for the first time. So you're welcome to learn more about what we do there. Other than that, Employee Florida is, you can't see that because that is too small, but Employee Florida is where you go to search for for your next career opportunity. And again, all of our contact information is at careersourcenorthflorida.com. So feel free to reach out, and I'm done.
Thank you so much, Diane. Thank you. Let me get a drum roll for Step Up for Students. Come through for us, Keith.
Thank you.
Are up next.
Thank you. I feel so much pressure because now we're at the end and everybody's probably already kind of tuned out. So I'm going to try to make this very quick. So Keith Jacobs. I'm the assistant director at Step Up for Students. We are a scholarship funding organization. We're actually the largest scholarship funding organization in the country. And so, oftentimes we talk about financial needs, health needs, and education needs kind of separately. But the way that we like to look at it is that some of the health needs that some of these families are incurring causes some kind of financial strain within the household. And those financial strains within the household oftentimes leads to a child not experiencing the best education options available to them, given that, oftentimes families can't afford a private school option. So that's where Step Up for Students comes in. We're in our 20th year of serving. We are currently serving over 160,000 students on our income-based scholarships in over 2,000 schools in the state of Florida. So we have private school scholarships available for up to $7,000 per year. Per child for K-12 education. You can apply now. We're open. We're ready to go. And our eligibility requirements are as such. An average family of four making up to $111,000 is actually eligible for that scholarship up to $4,000. We have two income-based scholarships. We have our our Florida Tax Credit Scholarship, which is tax donation dollar for dollar for our scholarship program. We also have the Family Empowerment Scholarship, which also which comes directly out of the state's budget to help fund income-based students who meet these income requirements. But in addition to this, we also have scholarships available for the Family Empowerment Scholarship available for families who have who are military. Military families are automatically eligible. There it is. Military families are automatically eligible to receive up to $7,000 per year, regardless of income. So if you have a military, active duty military or a reserve-based family, you can be eligible. The dependent children of that armed force officer would be eligible for up to $6,000. Up to $7,000 per year. Also, this is very new this year, so this is hot off the press. So a lot of people don't even know this. If you are the dependent children, if you have dependent children of law enforcement officers, they are automatically eligible, regardless of income. So both of those that I just spoke of are regardless of income, eligible for receiving up to $7,000 for scholarships. And the reason why that's so important is because we want to make sure that those families are aware that it doesn't matter if you're the chief of police or you're the captain. We do believe that those children still have needs that need to be met in order to attend an education choice option of their choice. So last but not least, I want to talk about our other scholarships that we do offer. We do have a scholarship called the Family Empowerment Scholarship for Unique Abilities, which is for students with unique abilities or disabilities. So that includes rare diseases, autism, deaf, hard of hearing, vision impaired, some intellectual disabilities as well. And the reason why that's important is because we want to offer the opportunity for families who have students with unique abilities to have opportunity to attend a private school of their choice or use that money for therapeutic services. So the average for an eligible family, the average family for the Family Empowerment Scholarship for Unique Abilities, formerly known as Gardner, is the average is $10,000 a year toward tuition or toward therapeutic services. So that's a major relief to those families that are currently dealing with that in their household. We also have our Hope Scholarship, which is for students who have been identified as bullied in their traditional school setting. So if there was a bullying case, those families may be eligible for the Family Empowerment Scholarship, the Hope Scholarship. And we also have our Reading Scholarship as well. And the reason why the emphasis is on education choice right now, 48% of state of Florida right now is exercising some kind of education choice. So I just want you to imagine just being that child sitting in the classroom. You're able to keep up with the classroom academically, but you may have some sensory needs. You may be susceptible to bullying, or you may, just not socially fit in. It might not just be the right environment. It's not because it's a bad school, but it's just not the right environment for you. And I can speak personally, not only as an employee of Step Up for Students, I'm also a parent of a child with autism spectrum disorder who has gone through 8th grade or through 9th grade now, just feeling like he was trying to fit in and socially, in addition to being able to meet his academic needs. So, speaking as both a parent and an employee of Step Up for Students, I can assure you that the ability for a child to experience an education choice environment that will maximize their potential is something that will be everlasting and impactful in their lives. So I encourage any community organization or any family that's on this community fair to go onto our website, stepupforstudents.org, and explore the scholarships available to you and your families, and hopefully that you'll find one that meets your needs. And if you have any questions, I'll make sure I put my information in the chat. But I'm grateful for the opportunity, and thank you so much.
Thank you, Keith. We appreciate it. And listen, I know the time got past us. We have 3 slides to share. All the speakers are finished, but we just want to share 3 more items with you all before we wrap it up. And 4, we may not have time for Q&A. However, we'll try to get out a FAQ type of section in the electronic packet that will get out to all the attendees that attended. That will be helpful. All right. So we have a few upcoming events here at ELC. One is our Summer Kitpreneur program. There's the QR code. Grab your phone, try to get it really quick, and get your child registered for that. All the details will be in that QR code. We also have this Saturday in Jefferson County, not we, but we will be in attendance, is the Watermelon Festival. It's Saturday, June 18th, and the virtual run ELC, which is going to be June 23rd through the 26th. So if you did register for our previous run, it will be virtual, and you have 3 days to complete it. We want to hear from you. So we have dropped our survey link or QR code, in the chat for Facebook and Zoom attendees. Panelists, don't worry about completing this one. We're going to send a personal one out to you, but please, attendees, take your time, complete this quick survey. It's really quick. It's going to help us improve our future virtual or future resource fairs. Again, thank you all so much for attending our virtual community resource fair as we raise the roof with all these wonderful resources our agency shared today. For more information, feel free to contact us on our CCR&R Child Care Resource and Referral line. The number is listed here. I'm going to call it out for our Facebook Live. 866-973-9030. Also, you can reach us via email at ccrr@elcbigbend.org. And don't forget to check out our new website, elcbigbend.org. Thank you all for attending. Bye.